South America, and it has a rising zero prevalence in United Kingdom. There is significant zoonotic burden as it transmits through the cats and livestock. There are serious public health concerns as well because of the congenital transmission risk. When we talk about the epidemiology of toxoplasmosis, it is prevalent worldwide and it has high rates in areas with the warm and humid climates. The infection is particularly concerning in pregnant women due to the high risk of congenital transmission, as the Toxoplasma gondii can transmit and it can pass through the placenta. This Toxoplasma gondii infects about 30 to 50% of global population. It is currently endemic in Europe, Africa, and South America, and it has a rising zero prevalence in United Kingdom. There is significant zoonotic burden as it transmits through the cats and livestock. There are serious public health concerns as well because of the congenital transmission risk. When we talk about the historical background, the causative agent of Toxoplasma, named Toxoplasma gondii, it was basically discovered by the Nicole and the Menzies in 1908 in Tunisian rodents. The human infection firstly was recognized in 1939 as the congenital cases were reported in 1940s. The global incidence was estimated at 1,90,000 congenital cases per year. The socioeconomic burden includes the neurodevelopmental delays, fetal loss, as well as the ocular damage. However, there are recent molecular studies which enhance the diagnostic precision of this infection. The causative agent, which is the Toxoplasma gondii, is an obligate intracellular protozoan of phylum Apicomplexa. It exists in three forms, named Tachyzoid, which is the acute form, Bradyzoid, which is the chronic one, and Oocyst, which is environmental form. It is capable of infecting all warm-blooded animals, and it forms tissue cysts in muscles and as well as central nervous system. This Toxoplasma gondii can be controlled by the human immunity or the host immune system. However, it can reactivate in the immunocompromised individuals. Here is the morphology of Toxoplasma gondii, where the three phases are shown, named Tachyzoids, Bradyzoids, and the Oocyst. Tachyzoids are basically rapidly dividing forms, and they are responsible for the acute infections. The Bradyzoids, they are the slowly dividing forms, and they form tissue cysts during the chronic infections. The oocysts, they shed in the cat feces, and the infective form, these are basically the infective form which are present in the environment. The transmission of Toxoplasma gondii includes the reservoir or the definitive host as felines or the cats, as the felids are the definitive host and these are capable of sexual reproduction of the parasite. These felines, they shed millions of oocysts in their feces after the infection. Then these oocysts, these can remain viable in soil for more than 1 year. These cats, they acquire the infection via the predation of infected rodents or the raw meat. These infected rodents basically act as the intermediate host in the Toxoplasma gondii infection. Here is a transmission cycle which shows that the felines or the cats as the definitive host. These definitive hosts or cats, when they ingest the tissue cyst, they can form millions of spores or the oocysts which are unsporulated within the cats. Then they shed those unsporulated oocysts in their feces, and those unsporulated oocysts first convert into sporulated oocysts. First they convert into sporulated oocysts, they can either go to the intermediate host and the oocyst in the feed, water or soil, and these are ingested by the intermediate host. These intermediate hosts include pigs, poultry or the smaller ruminants including goats and sheep. Then within the intermediate host, these tissue cysts and these oocysts can convert into the tissue cyst. These tissue cysts can again be ingested by the felines, which are the definitive host, and then the cycle may continue. The other chance can be the conversion of these sporulated oocysts towards the humans. When the humans eat the contaminated food or the uncooked food of the intermediate host or the contaminated water, they can get the infection. Then these humans they get infected by the Toxoplasma gondii. Now within humans, the females, especially the pregnant females, they are on high risk as they can transmit the tachyzoids through their placenta to the fetus, and then the fetus may also get infected. The intermediate host and the human exposure can be explained as the humans are the accidental intermediate host. The humans are accidental intermediate host, and the infection may spread via ingestion of sporulated oocysts, soil, in vegetables or water. Undercooked meat contains tissue cysts, and these can be a major route. The rare transmission route through the organ transplant or the blood transfusion can also occur. Environmental survival of the oocyst shows that the oocysts are highly resistant to the desiccation and temperature extremes. They remain infective in moist environments up to 18 months. And the municipal water contamination outbreaks documented globally. The chlorination remains ineffective, however, only boiling or the inactivation through high heat may work. The zoonotic cycle may include food, water, and animals. As a livestock, they act as a bridging host, or you can say the intermediate host between the cats and humans. There can be waterborne, soil-borne, or foodborne transmission interconnected. The integration of One Health is a critical approach for the control of this infection. When we see the life cycle of Toxoplasma gondii, it actually has two cycles, or the life cycle can be divided into two subcycles, including sexual cycle, which includes the feline gut, and the asexual cycle, which includes mammals or the birds. The sexual cycle, as you can see, it is present in the feline gut or the feline intestine, where the schizogony and the gametogenesis occurs, and it converts into zygote fusion. Then there is an environmental phase where the oocyst maturation occurs within the environment, or you can say within the soil. And then if the accidental ingestion occurs, it can convert either to the schizogony gametogenesis and a cycle completes, or it can go towards the asexual cycle, which includes the presence of mammals and birds. When the accidental ingestion or the oocyst maturation occurs within the mammals or birds, or you can say the intermediate host, they convert into the tachyzoids. And tachyzoids, they are they result in acute infection. These tachyzoids, they can also go towards the bradyzoids, where the chronic infection occur and the tissue cyst formation may include. If the host becomes immunosuppressant in any case, it can again convert into the acute infection phase and the cycle goes on. The sexual reproduction in cats include gametogony and sporogony within the feline gut, and the oocyst excretion begins within 3 to 10 days post-infection in the feces of the cats. The shedding lasts 1 to 3 weeks and they produce about millions of oocysts. After that, asexual reproduction occurs within the intermediate host, and the trachezoids multiply rapidly and they disseminate via the bloodstream. These trachezoids, they can invade within the tissues. After invading within tissues, they may form bradyzoid cysts, which are also called as the muscular cysts. The latent infection persists lifelong, and the bradyzoids may stay within the muscle cyst for whole life or until or unless the individual within which the bradyzoid cysts are present, it may turn into immunosuppression. After the immunosuppression, these bradyzoid cysts, they may reactivate and they can convert into the tachyzoid cysts, and then again the acute infection may occur. When we see the pathogenesis, the mechanism of infection and tissue invasion includes that the parasite basically penetrates within the host cells using specialized apical complex. It avoids lysosomal fusion and it can replicate within the parasitophorous vacuole. These parasites, they may trigger inflammatory cytokine responses including interferon gamma and interleukin 12. The cell-mediated immunity limits trachezoid application. CD8 T helper cells and NK cells, they are the key cytokines in controlling the infection. The bradyzoid cysts remain dormant, but they are detectable serologically. The sign and symptoms or the clinical aspects include that the acute infection shows a flu-like symptoms. There can be lymphadenopathy as well. However, the chronic infections show that latent cysts present in the muscle cyst and the potential reactivation may occur. If the patients go immunocompromised due to any reason, it can result into encephalitis and the pneumonitis. The toxoplasmosis in pregnancy is of major concern as it results in abortion in most of the cases. The primary maternal infection, it turns into the transplacental spread and the fetal risk increases with gestational age. If the infection occurs in the early stages, there can be abortion or the stillbirth. However, in the later stages of pregnancy may result in neurological or ocular defects. The pathogenesis of fetal damage and abortion may include trachezoid invasion in the placental trophoblast. The placental necrosis and villus inflammation may occur in the compromised nutrient flow. There can be the repeated abortions which can be linked to persistent infection and immune tolerance failure. The maternal risk factors include undercooked meat consumption, poor hygiene, and cat exposure of the pregnant females. There can be lack of immunity before the conception, and as well as there can be rural residence or the exposure to livestock very frequently. When we talk about the diagnosis of toxoplasmosis, there can be many methods, including one of the important method, which is laboratory diagnosis. We can go for the serological test, where we can check the immune status of IgM, IgG, and IgG avidity. However, there is PCR detection in blood as well, where we can go for the PCR in blood, amniotic fluid, as well as in tissues. The histopathology of the tissue cyst may help us in identification of the parasite. The prenatal diagnosis may also occur via the amniocentesis. Treatment options include a combination of pyrimethamine, sulfadiazine, and folinic acid. It is basically used as a standard regime. However, spirimycin it is used in pregnancy as a first-line preventive therapy, and there can be limited efficacy against the tissue cysts. Along with treatment, there can be certain managemental options as well. We can manage the infection during the pregnancy by observing the following routine. There should be a routine screening for the seronegative women, and there should be immediate spiramycin after seroconversion. The prenatal follow-up with amniotic PCR testing should also be followed as a managemental technique in pregnancy. To avoid the infection in humans, there should be some preventive measures. Humans should cook the meat, especially of chicken, for more than 67 degrees C. They should wash the fruits, vegetables thoroughly before having them. Avoid contact with the cat feces during pregnancy. Use gloves when gardening or handling the soil. To control the infection in animals and in environment, we should follow the following preventions. Prevent the cats from accessing livestock feed. Control stray cats population. Education of farmers and pet owners should be concerned, and there should be proper disposal of animal waste. The public health and global strategies include the integration of One Health as a paradigm of veterinary, medical, and environmental concerns. There should be national surveillance system of this infection, which should be based on annual basis. The development of vaccines for cats and livestock should be majorly concerned by the governments. So, concluding the topic, there are some takeaways and future research that toxoplasmosis remains a significant preventable cause of fetal loss. Enhanced screening and education can drastically reduce the risk, and novel therapies and vaccines under development should be there. There is a need for improved diagnostic tools in those resource settings to avoid and for the early diagnosis of the infection. Here are the references which are used within the presentation. Thank you.